कॉमन मिस आसा की एक लॉंग ड्युरेशन लागतले होमिओपॅथीचे टॅबलेट्स किंवा रिस्ट्रिक्शन्स खूप असतले डायटरी रिस्ट्रिक्शन्स असतले इन शॉर्ट यू कॅन वॉट एवर यू फील अँड वॉट इज राईट अकॉर्डिंग टू युअर line of thinking you can just address.
With dietary restrictions, there is nothing much that we generally tell to restrict, especially in kids. The only thing that in homeopathy is something that's very restricted is use of external ointments. For example, if children come with skin related complaints, eczemas and all, we do not allow to apply ointments, medicated ointments on the skin, because even any skin ailment is an internal disease which is expressing out at the level of the skin. Okay, so kita jata people generally patients make use of ointments, it goes off. Stop using ointments, it comes back again. Just telling you that it is not an external illness, it is something that is internal. So in such conditions we only give internal medicines, we do not give ointments, we do not give lotions, anything to apply for the externally. If it has to heal, it has to heal with the internal medications. That's one thing. Another myth, something is what parents generally do is they generally go outside to a pharmacy and they tend to self-medicate.
Correct.
You get a lot of patented homeopathic medications and they think that's homeopathy because they're picking up the medication from a homeopathic pharmacy. But for something to be homeopathic, we need to match. As I told you, it's based on similar current. So the patient's picture has to match with the drug picture. Only when the two of them meet together is when you will get a cure. For example, for a homeopath, if somebody has got cold, for example, just a runny nose, what color is the discharge? What increases the discharge? How did he get it? Did he have something cold? Did he go into a cold atmosphere? All that differs and helps us to differentiate one patient from another patient. How is the child during the sickness? You'll have some children who are extremely cranky. There will be some children who do not want to go to school. There will be some students, even after they are sick, they are extremely studious. All these small points help us to differentiate one child from another and one drug from another drug, which doesn't happen if you go over the counter and get a homeopathic medication.